Meeting to order. It's 10:34 in the morning. And we're going to go over the September 2023 bills. On the first page, I have a question under Beller's Plumbing and Heating. Is that the contract where we pay for the maintenance in the building?
No, that was, they replaced an AC condenser in Harbor Springs. They sent us the bill in June, but they sent it to the Petoskey office and it got lost along the way somewhere, so we did not receive it until September.
But we've maintained the furnace and all that in that contract?
No, this particular bill is just for that new AC condenser that they put in.
An AC condenser failed and they had to replace it, so this is to replace an AC condenser.
Right, but we're paying for that?
Yes.
So the
Yeah.
contract must say that we have to replace everything.
You're thinking of, because we pay rent to Emmett County, is that what you're thinking of? That they should be responsible for it?
No, it seems like a lot of the contracts are all different. Some you pay for maintenance of the equipment and some you don't. Or all yours like that, where you pay for everything in them.
No, this is just in the, Harbor Springs Health Department building. We had an AC condenser that couldn't be fixed any longer, so Ballard's came in and replaced it. So it's not a maintenance contract, it's new
No.
equipment. that
Yeah,
we
right.
replace.
No, I mean the agreement with the health department and the building.
Oh, so we own,
I'm wrong, sorry.
gotcha, we own half of the building in Emmett County.
Okay,
The other half is reverted to the county, so this is the half that we still own.
oh, so you do own this part.
Yes, yes.
Okay, that makes sense. Cause I know at the last meeting, Neil asked something about
Yeah.
a contract in which we were paying to replace stuff. And I agree with you, Neil. If we're renting, why should we pay for it?
Well,
Right.
typically you don't, but you know, if we have a contract with the entities, we have to follow the contract till
Right.
it's over with. Obviously, we should look at some of this stuff when we renegotiate these things.
Right.
That's
That's the
okay.
question I had on this bill.
I've done that before.
Yes, I agree.
That happens. Yeah.
Okay, cash conference. What does cash stand for?
Childhood, adolescent, and school health.
That's like, we're sending 12 or 13 nurses to a conference.
Yeah, I just didn't know what that stood for. And Charlevoix Auto, it says new tires for dental van. Is that separated? Like oil changes and that, are the tires there, that's separated with the dental? On
Yeah,
vehicles?
that comes out of this is for the seal, or the van that the health department has, so this is in the budget for the Seal Michigan program.
This is the one dental hygienist that we have on staff at the health department. She is not with Dental Clinics North. She is the health department completely employed. She does the kindergarten oral health screenings, senior smiles, sealing clinics. So this is truly health department employee. And she got the van through a grant with Delta Dental. So that's how we ended up with this.
Oh, that's cool. They got a grant with a van?
They did, yeah.
Oh,
That's
that's
great.
awesome.
5, 6 years ago.
Amen.
You'll see it around town. I think it's a white van that says Delta Dental all over it, and Health Department of Northwest Michigan.
No, but I'll have to look for it.
Yeah.
That's cool.
Delta Dental all over it. Does that mean that we're getting paid for advertising for them?
And they paid for most of the vehicles, so yes.
Okay. Okay.
Delta Dental paid 100% of that van. Don Marie grant to see if they would cover that, and
Okay.
they said they would.
Cool.
That's awesome. And the last one I had on the first page was DEXIS. Is this software or is that equipment?
It is a service maintenance agreement for the sensors, the dental sensors that all of the clinics use, and it's to break it out, it's cheaper to do this agreement than if they have those sensors go bad to replace them or to have them fixed, because there's, I wanna say there's like 20 different sensors.
And this is a one-time annual.
This is a one-time, it's once a year cost, and they are, those sensors, I can see where they send those sensors quite often to be repaired. Or if something happens to them, they will replace them.
That's good. I don't have anything else on the first page. Neil, do you?
Yeah, let's see here. I can find it again. Here we go. I'm just curious on Charlevoix Commercial Center LLC. It says $181 for mini storage for medical record storage.
Yeah.
Is that as secure as it needs to be? Medical records?
Yes,
Yeah, it's a mini storage that we have in Charlevoix. It's under lock and key, and there's only a few people that actually have a key who use it in our staff. You can't just
Okay.
go right in.
yes.
At
That was
some
my
point,
that's my only concern.
yeah, and at some point in the near future, we won't have that. We've gone paperless, all electronic records.
Okay,
So those are just the paper, medical records, some we have to keep indefinitely, and then every 7 years we keep shredding. Another year, so at some point, we hopefully won't have that.
yep. That's a continuing evolution for every entity around here. You know, Emmett County included, we're still trying to figure out how to deal with a lot of our storage too, so, yeah. That's all I had.
Okay, page 2. I have under Grand Valley State University Lab Proficiency Testing Service. Is that to the testing for people to take?
No, that's, it's part of our sewer network. So we've been testing the sewage because there has been known to have traces of COVID in it. And so if we see high levels of the virus in the sewage, then we know that there potentially could be an outbreak in that area. So we hire Grand Valley State University to do the actual testing of that sewage.
So where do they send that to them?
Yes.
Yeah, they send samples to them, and this is actually, they had been sending invoices, but they had been sending it to an employee who was out on extended leave. So we weren't getting them, and then they finally reached out questioning, so this is 3 months worth of invoices.
Okay.
They
That's
know
the
the
only thing I
correct
have.
address now, don't they?
I certainly hope so.
I don't have anything else, Neil, on that page.
Is anybody talking? Or did we lose
No,
it?
nobody's talking. Do you have anything on the second page, Neil?
No, I'm done.
Okay, I'll go to the third page. The Michigan Council for Maternal and Child Health, that's a membership, but just tell me what that is, so I know.
It's a membership for the maternal and child health. I'm not exactly sure what benefits they get from that membership, but what it actually is, the health department is paying the $2,500 annual fee, but we are billing 7 other health departments for their portion of it. So it actually is only going to end up being like $380 because we will get revenue back against but we're paying it all up front on behalf of the other health departments. But I can find out specifics on what that membership, what the benefits are. And email back to you on that. I'm not exactly sure what
Okay,
benefits.
might do
on that.
training or something.
Yeah,
What's NASN stand for?
National Association of School Nurses.
Okay. So that's for them. So
And
they-
that was for multiple nurses. There was, I want to say there was 10 nurses maybe
Throughout the four county,
throughout within the health department.
okay. So that probably gives them access to information and workshops and trainings and things like that. How about the Community Health Alliance of Michigan annual? With some with schools,
School Community Health Alliance of Michigan. It's the same type of thing.
Oh,
Annual
yeah.
membership, they get training and it's mostly training and conferences they can go to.
yeah,
This is, all of the, or not all of, but a lot of our,
annual,
school-based, the school-based clinics.
That includes like mental health services.
Yeah.
It's not just nurses at this. point.
Yeah,
how about this, my last one, the doctor's company?
That is Dr. Meyerson's professional liability insurance. And so we do, bill a portion of that to Benzie Leelanau in District 4 because he's also the medical director there. So we actually only end up paying like quarter of that or a third of that.
So are all the, do you have directors and officers insurance or is yes? And then people are, have liability insurance too, or just him?
He is the only one that has this type of insurance because he's our medical director. So most of our services are, if we're billing insurance, are billed under Dr. Meyerson's name. And then, our social workers, we have to cover their insurance as well because we bill under their NPI number. But Dr. Meyerson, if it's just a nurse that's doing like vaccinations or something like that, it gets billed under Dr. Meyerson's name. So he has to have a little bit more coverage, because he's like overseeing all of the medical services within our agency.
And that's for a year, yes, that's for a year.
Yep.
That's the only thing I had on that page, Neil.
I don't have anything.
Nothing?
Nope.
Okay, the next page. So the credit card went through the ACH payment instead of a regular bill?
we had to make an ACH payment because we were reaching the credit limit and there wouldn't have been enough, left on the card to wait for a check to get there, so we had to make an ACH payment.
Yeah, 9/30 is our fiscal year end, so that's when we have a lot of purchasing going on. And it gets very busy, so Paul was at the end of the credit card maximum, and we had to do something so we could continue getting everything in that we needed at year end.
Does it cost you money to do it that way?
No,
Wouldn't it be better to do it like that every month so you won't lose something in the mail?
We were just talking about that this morning.
We're thinking alike.
Yeah. I said to Karen, why are we still, because we have to overnight the check again to them
Right.
today. Now that costs money.
Right,
So I said, we really need to look at eliminating the paper.
especially if it doesn't get there, you're gonna have your fees.
Yeah.
So, yeah, so you read our minds. We are thinking about that.
That's good. I agree with you. And what's the ACH payment 921? Are they both credit cards?
no, that one was, our monthly, Microsoft licenses,
Okay,
invoices. the email got deleted by accident, and for the life of me, I could not find that email, no matter how hard I searched to get it in the bill pay. And so we had to do an ACH payment to get that paid right after the bill pay. I had to reach out to the vendor, and then when they sent me a new one, I figured out why I couldn't find the email. But I was not searching correctly in any way, shape, or form, so
They don't charge you extra for ACH, do they?
I did not charge extra for that.
Yeah, so it's wise to do it that way if you can, because it's instant.
We are actually moving away from them as a vendor for our Microsoft, so you're only going to be seeing payments to them for maybe a couple months, and then we'll be moving on to somebody else,
Okay,
so.
those were the only questions I had on the
Any new
bills.
vendor that we set up, we do send them an ACH application because that is our preferred method of payment now.
Right,
Yeah, the post office has just gotten crazy.
and long, it takes forever.
Yes,
It seems like it's half a week more than what it ever was. By the time you get it, you forgot what it was for. So our total is 706,361.33 for bills. You have anything else on those bills, Aaron? Neil?
No,
Okay. You have any questions on the earnings history?
no, I have a,
I think the earnings history people are pretty much close to the same thing every month. You know, and if you're going to be doing less traveling, I would think that that would make those a lot less in the future.
Sure we'll ever get rid of the travel in total, but I mean, there's our, like our, environmental health guys, they're always gonna have travel
Right.
involved. But yes, as we pull back some of the other stuff, it'll be a little bit less to look through, so.
Right. But it's pretty self-explanatory. I mean, it's pretty much the same people over and over, depending on how much they traveled.
yeah.
So what's our total? 706 and
So that, the expenses total up to $18,880.67.
so what's our total between them both?
Oh, I don't know.
What did you say? It was 18,811.60?
18,880.67.
Well, calculators. Was the other one? $89,512 exactly.
Wow, exactly.
Wait, that's not right.
That's not right.
I need to run.
800.
I'm like, that's not right. I don't-
89?
hold on. Calculator to come. 18,880.67. Here we go, 725, 242. $725,242. Even, well, 67.33.
Yeah, that's right. That's better. Okay, we have the bills done. Now, the next question, Neil, is do you go hunting on November 15th?
no, I don't.
No,
No.
that's our next bill pay meeting is November 15th.
Oh, well, that's fine with me.
At any time or what? What's the best for you?
Oh, I don't know. Mornings are good.
So should we just keep it at 10:30?
Yeah, that'd be good for me.
Let's keep it at 10:30 and see if the other two people are fine with that.
Okay.
Plan on it for now.
I will have Melanie send you the voucher and the other page through Sign Now for you to sign.
Sure.
So look for an email later this morning from Melanie.
Okay, sounds good. Do we have any other business today?
Do we have to vote on this or? to pass it along, or what do we have to do?
Yeah, we just recommend to bring it to the board meeting, the
Okay,
bills.
we don't have to do a we don't have to do a vote. Okay,
No,
all right,
Done for signature though, to both of you, right?
Yeah.
Yeah.
just send us an email.
You'll both get it. We
Okay.
need two
Sign it.
signatures.
Okay.
Okay, I think we're all,
Thank
good
you.
job. Thank you for showing, Neil.
oh, no problem, Don, we missed
Okay.
you, Mac.
Yeah, yeah, I know.
Good luck with the plumber.
Okay, take care, guys.
Take care. Bye-bye.
Bye-bye.
Thank you.